Hey guys, Dr. Kilfoil here. Today we're going to be talking about celebrities with interesting feet. Typically I'm not a guy who wants to talk about celebrities. It's not very interesting to me, but that's interesting to other people. Hey, whatever, to each their own. There's a couple of videos on YouTube that go through some of these pictures, but they don't really explain what's going on. So I'd like to explain what's going on from a podiatrist perspective. So first up, we have Oprah. Oprah has a bunion. You can see this big lump that's hanging out the side of her foot. That is the first metatarsal medial eminence is what we call that. The $5 word for bunion is hallux abductovalgus. So hallux meaning big toe, abducto or abduction meaning that it's headed away from the midline, and valgus means that there's a frontal plane component, typically means eversion away from the center line. She has definitely an adductus component to her HAV. You can also see she has some hammertoes going on with a little bit of hypopigmentation. Hypo meaning less, pigmentation meaning less pigment. Right here on the dorsum of the second and fourth toes. She must not be in a lot of pain. I imagine that she can afford the best surgeons in the world to correct this. However, it's when you have an intermetatarsal angle that is as severe as hers, typically you need an invasive surgery such as a Lapidus procedure to actually cure this and doing it the right way. Because she has a severe bunion, that might be one of the reasons why she's not getting herself treated. Because the surgery would be way too invasive. She would need to be off weight bearing for a certain period of time depending on the hardware that's used. And so that's that. Hallux abductovalgus, hammertoes, some hypopigmentation, and we're moving on. Here we're talking about Jennifer Aniston. Jennifer Aniston has some vascular feet. These are not pathologic. This means that there's nothing wrong with them. There's no varicose veins. This is just a reflection of how little subcutaneous fat she has on her feet, and that could be a genetic thing. You know, she's not a big lady, so she doesn't have a lot of fat on her, and that could be one of the reasons why this is so visible on her compared to other women. You usually see low amounts of subcutaneous fat on men, especially their hands and arms. You can see it on their feet as well. She just has very vascular feet. There's nothing wrong with these. Here we have Steven Tyler. Steven Tyler has something interesting called a crossover deformity of the second toe. Steven Tyler has a crossover deformity where the second toe goes on top of the first toe. That's typically caused by a problem with the plantar plate. The plantar plate is the ligament that connects the metatarsal to the phalanx on the plantar aspect of the joint, on the bottom of the joint. And a lot of times the lateral aspect on the outside towards the pinky toe of that ligament gets disrupted. It could be from a tear or being stretched out, and the toe ends up going medially. It adducts, and there's only got one place to go. It can't go through the big toe, so it heads on the top of it. And so you get some rubbing injuries, from the shoes on the dorsum of the proximal interphalangeal joint. You get some pinch calluses sometimes between the first and second toe, but the majority of the pain typically is on the bottom of the foot where that plantar plate has its pathology. It's challenging surgically to correct because a lot of times it's the results are not very predictable. The other thing I wanted to mention is that he is using nail polish. Typically you see men do that. Now, of course, typically men aren't Steven Tyler rock star. That might have something to do with it. But most of the times when I see men doing that, it's because they have onychomycosis. They have a fungal infection of the nail that is leading to their embarrassment, so they cover it up. Onycho meaning nail, mycosis meaning fungal infection. So he has it's potential fungal infection of the nail, but I can't tell because he's covered up with fungus. Here we talk about Kate Moss and Katie Holmes. Both these ladies have something called hammertoes. There's different kinds of hammertoes. One is called the mallet toe, where the distal interphalangeal joint is plantar flexed. The regular hammer toe is when the proximal interphalangeal joint is flexed, but the distal interphalangeal joint is dorsiflexed. And there's claw toe when both the proximal interphalangeal joint and the distal interphalangeal joint are both plantar flexed. That's called a claw toe. These ladies have hammer toes proper, and they can either be classified as rigid or flexible. If they're flexible, some stretching exercises might delay any kind of need for surgical intervention. However, if they're rigid, There's nothing you can do to solve the problem except to remove a small piece of bone in a procedure called an arthroplasty, a hammertoe arthroplasty. All right, next we're going to talk about Ashton Kutcher. Ashton Kutcher has a condition called syndactyly. Syn meaning together, dactyl meaning fingers or toes, digits. And a lot of times this is not painful. You'll see more painful ones when the syndactyly reaches all the way to the tip of the toe. You see on his that it's only going up to the proximal interphalangeal joint. The surgical correction of this is rather difficult because you have to create a wound that will not close primarily. What I mean by close primarily, meaning that you could stitch it back closed. When you split these guys open, there's not enough skin to cover them back up, so the body has to fill that in secondarily, we call it. It's healing by secondary intention. And because of that, there's an increased chance of bad scars, hypertrophic scars, things like that. Risk for infection. It's going to take a longer time to heal. These are relatively complicated compared to other procedures. So I don't blame him for not getting this corrected, especially since he's not embarrassed by it and it probably doesn't cause him pain. I wanted to talk about Lebron James. LeBron James is one of the best athletes that is alive today in his own field. He's considered probably best of all time by a lot of people. And when you say somebody has a flat foot and that's a deformity, you say somebody has a bunion, that's a deformity. Well, this guy's got a flat foot and bunions, but he's one of the best in the world. So who's deformed here? This is not a deformity. I think that there is probably some evolutionary advantage to flat feet and maybe bunions. We just haven't been able to really articulate it very well. But I'll tell you what, if we move on to Mr. Usain Bolt and we look at his feet, we can see that he also has a bunion and relatively flat feet. And he's the fastest man alive. So who's really got the deformity here? You with the normal looking foot, or Usain Bolt, who's got a bunion and a flat foot, but is the fastest man alive? So I just wanted to, try to put this thing into perspective, what we consider deformity and what is not. Because you don't want to hear somebody tell you that you have a deformity, that's for sure. One thing about Usain Bolt's toenails is that you can see that there's some discoloration. It's very common with runners. A lot of micro trauma will lead to small openings within the nail plate, allow fungus to get in. So this is probably onychomycosis, but there is a chance that this is just plain old dystrophy, dys meaning improper, trophy meaning growth. So a lot of times micro trauma to the nail root, right proximal to the nail, you can get scarring of that nail root, the germinal matrix, and the nail that comes out of that has this appearance that may be fungal. It's hard to tell. You would take a culture, KOH-PAS, and find out if there's actually fungus in there, and if there was, you could treat it. But that's it. Thanks for watching, guys. New videos coming in soon. Every day is the best day of your life.